The U.S. is breaking new records in its coronavirus vaccination efforts. President Biden announced the U.S. administered 20 million vaccine doses in just 7 days. Nearly 4 million were administered on Thursday alone. As of Friday morning, roughly 17% of the population has been fully vaccinated. More than 101 million people have received at least one dose. The CDC is also updating its travel guidelines for anyone who is fully vaccinated, but the good news comes with a warning. Omar Villafranca has those details from Los Angeles.
With 58 million now fully vaccinated, the CDC has news many have been waiting for.
Fully vaccinated people can resume travel at low risk to themselves.
Vaccinated Americans won't have to get tested or quarantine after travel, but the guidance comes with a warning.
CDC is not recommending travel at this time due to the rising number of cases.
Nationwide, cases rising at least 10% in 24 states. Michigan, the hardest hit. Daily cases up 5-fold since the end of February. The biggest spike in kids, as infection rates jumped 230% among those under 10. Johnson & Johnson now expanding clinical trials on children as young as 12, coming on the heels of Pfizer's data that its vaccine is 100% effective on adolescents. Moderna tonight getting permission from the FDA to increase the number of doses in each vial from 10 to 15, which could help speed up vaccine distribution. And Northwestern Medicine releasing a study showing that pregnant women vaccinated early in their third trimester were likely to pass on antibodies to their newborns, a potentially significant finding to expectant mothers concerned about receiving a vaccine. As states continue to relax restrictions, Michigan's governor is hoping vaccines are the way out.
We may be seeing the light at the end of the tunnel, but we are still in the tunnel, and it bears repeating. The best thing that we can do right now is to follow the protocols.
This vaccination site in Los Angeles has administered more than 300,000 vaccines in about 6 weeks. Nationwide, expect to see more pharmacies offering doses as the U.S. government plans to double the amount of pharmacies receiving the vaccine. Lana?
Omar, thank you. For more now, let's bring in Dr. Len Horovitz. He is a pulmonary specialist at Lenox Hill Hospital in New York City. Dr. Horovitz, thank you for being here and for everything that you do. So earlier this week, the head of the CDC said vaccinated people do not carry the virus. But now the agency appears to be walking back those comments, saying the evidence isn't clear yet. Dr. Horovitz, remind us, what do we know about how vaccines work, and can vaccinated people still get infected and, more importantly, spread the virus?
The final details of some studies are not in yet, but there seems to be, among healthcare workers who get cultured frequently, a finding that they cannot transmit the virus to patients and to each other. So it would appear that the idea of asymptomatic transmission, even in vaccinated people, may not actually be the case. There's a study currently going on at the National Institute of Allergy and Infectious Disease involving 12,000 college students. Those results will be in September, and then we'll have the final answer as to whether the vaccinated people truly cannot pass on the virus.
So just to make sure we're all clear on what you're saying, the indications are that fully vaccinated people are not going to be transmitting the disease further. But until those final studies come in, it's better to just operate continuously out of an abundance of caution.
That's right. We still have to remember the public health mandates of masking, social distancing, hand washing, and of course, gathering. And with regard to travel, that's, of course, a situation where people are gathering in airports and airplanes, and they're traveling to places where people are not vaccinated. So we still have to keep in mind the public health mandates, even in vaccinated people, until we know for sure that they are not transmitters of the virus.
I want to understand that a little bit more deeply with you, this point about fully vaccinated individuals, according to the CDC, can safely begin traveling again. But still, the CDC says that it's not recommending it, given the rising number of cases. Help us to understand why they aren't recommending travel for fully vaccinated people.
If everybody were vaccinated, people could travel a little more easily. The fact is that only 17% of the country is vaccinated, so you're traveling with people who aren't vaccinated. And therefore, there's a lot of mixing of vaccinated and unvaccinated people. Until we know the answer that a vaccinated person cannot actually pick up the virus and transmit it, the public health recommendations have to be that we use caution. And obviously, if we're all vaccinated on an airplane, we don't have a problem. But that's not the case.
Right. Well, I want to switch gears and talk about kids and teens because we've been seeing higher rates of those groups being infected. Data from Michigan alone shows cases among kids under 10 jumped 230% since mid-February. Cases among those 10 to 19 years old jumped 227%. Experts have previously said that there is low transmission among children. What do we know about how COVID affects kids? And given this tremendous increase, should we be really concerned?
Most children who acquire the virus are asymptomatic. Of course, that's not always true. We know children can get just as sick as adults. There's myocarditis, renal problems, kidney problems, and of course, multi-organ system failure in children. It's rare, but it happens. Children often, as I said, are asymptomatic, but sometimes present with unusual symptoms that get passed by. For instance, rashes or so-called COVID toes, which don't seem to be alarming to parents, but they're clearly a sign that children are infected. And of course, children spread to each other, and they bring the virus home to parents and grandparents and relatives, caregivers.
Well, Dr. Anthony Fauci now says that there should be enough information to safely vaccinate children by the end of this year. How important is a vaccine for children?
It's incredibly imperative that we try to vaccinate as many children as possible, since they are vectors of the virus and they are spreading the virus, particularly the B117 variant, which is more lethal. And so we would like to vaccinate, of course, the entire population. We would eventually like to vaccinate as early as 6 months. The studies now indicate that 12 to 18 years is a perfectly safe time to vaccinate, and that the vaccine is almost 100% effective in that group. And so studies will be done in children younger than that. And hopefully, as we vaccinate all the adults, we'll get to all the children as well. And then we will hopefully reach herd immunity.
All right. Dr. Len Horovitz, thank you.
Thank you.